I wish above all things that you will prosper in all things, as in health, as your soul prospers. In other words, God wants us not only to be saved, He wants us to be healthy. He wants also us to be financially prospered. Right? So today, I'm going to teach you something. It's about your health. Because I believe that God don't want us in heaven young. He wants us to stay as long as we can on earth so we can do our purpose on this earth. So if we die early because we are negligent, because we don't know how to do with our health, then we die early and then we will be able to do our purpose. Okay? Praise the Lord. So today, I'm going to teach you about something that is very common. Every day you're reading a newspaper. It's about dengue fever. Okay? So last time I taught you about hypertension, then I taught you about diabetes. Today it's about dengue fever. It's spelled dengue, okay? D-E-N-G-U-E. But this is a foreign word. It's pronounced as dengue fever. But it's dengue, okay? You always see in the papers every day. The government is really angry. In fact, they put a decree, I think, that if you don't clean your backyards, they will put you in court. I saw some people, charge $200 something, because they know that is very important. And I will tell you today why it is important, why they have to do that decree. Okay? So, what is dengue fever? Okay? So, dengue fever is a disease caused by a family of viruses that are transmitted by mosquitoes. Okay? Now you understand why the government is telling you to prevent these mosquitoes to be here, because it is transmitted by mosquitoes. Okay? So this disease, there are 4 kinds of viruses. It's not one. There's 4 serotypes. So it's dangerous because you can have it 4 times. You can have type 1, type 2, type 3, type 4. Okay? Before they said there was an outbreak of type 1. Now we have type 3. So still it's not good. That's why you can see it every day. We still have people sick. So dengue fever is caused by viruses, 4 kinds, that is transmitted by mosquitoes. Okay? So it is an acute illness. That means, acute means is sudden onset. It does not go slowly. All of a sudden, you are well today, tomorrow, all of a sudden, you got headache, fever, rashes, painful body, and everything. Then, that is what it means, acute. Okay? Very fast onset. Not like cancer, they call it chronic because it goes very, very slowly. It can take 100 years, 20 years before you can see the manifestation of cancer. But when you say acute, acute means all of a sudden. Okay? Today you're fit, tomorrow you didn't come to church. Why? You're sick because of acute. That means it's acute. So dengue is also an acute illness. So it's a sudden onset that usually follows a benign course with symptoms such as headache. You'll have headache, you'll have fever, you'll have exhaustion. That means you get easily tired. Okay? You're tired easily. That means exhaustion. Then severe muscle and joint pains. That's why it's also called a broken bones disease, because just like the bones are broken. Severe. There's one sickness, they call it flu, influenza. It's called Lautoka in Fijian. You get also muscle pain, but it's not that bad. In dengue, it's really very painful. That's why they call it a broken bone disease. Okay? The muscles and the bone, just like it's broken. So, fever, headache, exhaustion, severe muscle and joint pains, and you got swollen lymph nodes. You know what is lymph nodes? You see, when you get boil in your feet, you will have some swelling in your groin, something, or sometime in the hand, you got swelling in your armpit. That's what they call lymph nodes. It's not actually a boil. It is a swollen lymph nodes. Okay? So that's another thing. So, Lautoka, you only have fever, headache, but in dengue, you have all those things. Right? And another thing is, you get the main characteristic of dengue is rashes. Rashes means like dots, like plenty mosquito bites all together in one area. Okay? Yeah, that's what they call the dengue rash, is just like, plenty small blood clots. Okay? So that's what they call the rash. It's like plenty mosquito bites. Now also the presence of fever, rash, and headache, these are the more important. Rash, fever, and headache, this is what they call the dengue triad. Okay? This is the main characteristic. You get fever, you get rash, and you got headache. Above, these are the particular characteristics of dengue fever. And also, you will have bleeding gums. Okay? So that's dangerous when you start bleeding. Bleeding gums, severe pain behind your eyes. When you want to move your eyes, it's painful. Okay? So if you hear that kind of thing, you know, it's not only headache, you got a pain when you move your eyes. Then your palms, you know, the soles of your feet, they are very red. Okay? Those are the signs and symptoms, eh? Okay? And then dengue can affect anyone, but severe in people with compromised immune system. That means immune system is the power of the body to fix itself, okay? To fight itself. So when your immune system is weak, just like AIDS. AIDS is acquired immune deficiency syndrome. Same thing. If your immune system is weak, then you get sick quickly. Never mind the mosquito bites you. If you get a strong immune system, sometimes you can escape. Huh? But if your immune system is weak, oh, one bite, finished. That's what it means. So the people who are low immune system are compromised. They can be more sick. They can even die. Because it is caused by 4 kinds of viruses, so it's possible to get dengue fever multiple times. Okay? You went to the hospital, they said you got dengue. You went home after 2 weeks, you well. Then you get sick again. Why? Because there are 4 kinds. Maybe the first one was type 1, now the second one is type 3 or type 4. So far, there's only type 1 and type 3 hitting Fiji. See? So that's what it means. You can have 4 times. But not all headache, not all fever is dengue fever. You know that, right? There is a matitaka flu. But in flu, it's only headache, body pains, but there's no rashes. There's no bleeding. Okay? So those are the different things. So, however, an attack at one dengue produces an immunity for a lifetime. That means if you are bitten by a mosquito and you cause dengue, one type, you are already immune. Just like measles, okay? Measles or chicken pox. When you already had it before, you will never have it again. That's what it means. So even in dengue, if you were attacked by the first one, you cannot be attacked by that one for the second time. But I told you there are 4 kinds, okay? But you have immunity in it. So if you had already 1 in your lifetime, you got only 3 left, okay? Yeah, be careful, you still another 3, okay? So that's what I'm saying, eh? So that's what it means, that immunity is for a lifetime, but since there are 4 of them, you can have as much as 4 kinds and 4 times, right? Okay, so other names of dengue fever. Another name is, I told you, break bone or dengue fever. Why? Because just like your bones are broken, that's why they call it broken bones, break bone disease. So severe muscle pains, severe joint pains. Well, the slaves in the West Indies who contracted dengue fever said dengue fever because you know what they do? They walk just like this, just like they're walking like, you know, their gait. Because, you know, when your bones are painful, it's very hard to walk. So they call it dengue, dengue fever, that in the West Indies. So there's another kind, they call it as a dangerous one, DHF, it stands for dengue hemorrhagic fever, okay? Hemorrhage means bleeding. So it's a severe form of this kind of sickness. The symptoms will also the same, it will be the same, it has headache, it got fever, it got rash, but this time there is an evidence of hemorrhage, okay? Hemorrhage means bleeding in the nose, bleeding in the gums, and bleeding in everywhere. In your, when you pass your toilet, you will see bleeding there. Your toilet is black. Why? Because already burst inside your intestines. So that's not a good sign. When you passing your toilet with fever and you see your toilet is black, not like the normal color, that's a suspicious dengue. Okay? So that is one. And then, of course, it can also bleed in your brain. That's a dangerous one. That's why people die. There was one case in the papers lately, the father was complaining, the Ministry of Health and Investigation. Why? He said, well, my son went with fever, and then the next day he died. And then the Ministry of Health investigated, and they found out that he had hemorrhage in the brain. Okay? So that's the dangerous one. Your blood, the bleeding is not in the nose, not in the gums, but right inside your brain. So that's dangerous. That is what they call dengue hemorrhagic fever. So, petechia is a medical term for small bites. Petechia, the rashes that are all together. That's why when you get fever, what we normally, the doctors, what they do is they tie your, they get a rubber band or something, they tie your arm. They tie it, in other words, to constrict the blood flow. And if you get dengue, the rashes will come, like mosquito bites. So that's positive. That's a sign that you got bleeding. Okay? So that is the they call it tourniquet test. They put a tourniquet to tie it, and then you will see the spots there. That is just a shortcut, okay? So petechiae is the small spots. So easy bruising is also possible sign. You know, you just bump a little bit, you got bruises into your legs or whatever. So this kind of dengue fever can be life-threatening and can progress to the most severe kind of illness. It's called dengue shock syndrome. Okay, this is the one that kills you. Because when you got the shock syndrome, that means your blood pressure will go down, your blood vessels will dilate, you know. So no more pressure. Okay? So that's what they call shock. You will die. If you're not in the hospital, they cannot put the drip. No drip coming into your system, and you're in shock. No more. Finish. Because your heart will stop. So that's what they call the dengue shock syndrome. That's the most dangerous, but it's very, very uncommon. Meaning low blood pressure, dilatation of the blood vessels due to severe bleeding. You know, sometimes you bleed too much. So no more, all your blood is gone. Okay? So can bleed in the brain and cause death. So now, how is dengue diagnosed? How will you find it out? This is very important. So you can only diagnose them with the symptom, like you got, I said, you got fever, you got headache, you got rashes, you got, bleeding, pain in the head or in the eyes. Well, as I've said, the safest thing is don't diagnose yourself. You are not doctors. Just go to the health center, go to the hospital. Okay? Don't wait too long, just go same time because you're not sure. Because it's very similar to other kinds of sickness. It can be matitaka. Then you go home and sleep. Okay? But don't wait until they start bleeding in your nose, then you go. It might be too late. Okay? So because here, timing is very, very important. So when you see this fever, headache, especially nowadays, don't hesitate, just go. Never mind in the middle of the day, middle of the night, go. Go and have it checked. Okay? So dengue fever, well, before that, you can have a history. In that area like, in this area like now, dengue in Fiji is very common in the Central Division, Nosore, Suba, and Nandi, and Lautoka only. Very lucky, nothing in Ba so far. So Lautoka, Nandi, and Suba, very dangerous. When you have this kind of symptoms, you better run to the hospital, okay? Because this is they call it an epidemic, okay? Epidemic, that means plenty cases. So dengue fever is difficult to diagnose because its symptoms overlaps with other viral diseases, right? See? So the surest place to go is to the hospital because it's very common. It's fever, plenty kinds of fever, plenty kinds of rashes. Maybe you got allergy, you will also have rashes, but it's only allergy. But since you are not a doctor, as I've said, it's better to go and see, the experts. So it's also very common, like such as West Nile virus, they said, and chikungunya fever in Africa. Chikungunya fever, that's also similar, same thing. So in 2001, United States of America, FDA, the Food and Drug Administration, they approved a blood test to diagnose people with dengue fever. So they have, but this is very expensive. I don't know they're using it in Fiji or no, because this is a very expensive test. They call it Dengue Detect IgM Capture ELISA. Okay? So ELISA is the name of the test. I don't know, it might be $20, $30 each, so the government cannot afford to test everybody. Maybe some. Maybe only So normally we just tie them, we do the tourniquet test. But the FDA noted that the new test may also give a positive result in other cases. So it has a false positive things. You're having it's okay with dengue, but it's also positive. So it's a false positive. So it's not a sure job. And it's very expensive. So how is dengue fever contracted? This is important. How do you get it? So the virus is contracted from the bite of a striped mosquito. Okay? I haven't seen this mosquito in my life, only in the pictures. It is striped. They say it's called Aedes aegypti. That's the name of the species of the mosquito, not the one mosquito you see them, the black, all black. That's okay. That's not an Aedes aegypti. It will not cause dengue. That's mosquito. Okay. So this one is a stripe. It has a stripe. I've seen the pictures, but I haven't really seen them. So it's a striped mosquito that will bite somebody who got dengue. Okay. So this mosquito going, and then you got the one fellow with the dengue fever. He bites that. Then he will bite you also. That's how he will punch you. Just like malaria. In malaria, the same thing. You have to be bitten by that mosquito is just a transmitter. He bites somebody with a bacteria, I mean with the sickness of dengue, then he go and bites you. So like places in Suba where 20 people there already infected, and in places is very congested, see? So the mosquito can bite plenty in one go. Right? But he needs to bite a sick person first. If he does not bite a sick person, no problem with that. Okay? So you cannot get dengue. It's not contagious. Contagious means when you're sleeping with somebody with dengue fever, you get sick. No. Dengue is not like that. You can sleep with somebody with dengue, you won't get sick. That's contagious, they say. It's not contagious. But you need to be transmitted by a mosquito. Okay? The mosquito had to bite somebody with dengue and bite you, then you can have it. But if you're just sleeping with somebody with dengue, no, you won't, if there's no mosquito bite. Is that clear? Huh? Did you understand what I'm saying? So it's not contagious. So that is a relief. So mosquito flourishes during rainy season. Huh? So this is the time. So November, December, January, rainy season. So get rid of, breeding places like the government always saying, no plastic bags, cans, on the back of the house, old tires with water, you have to release them, you have to clean them because they want to breed. Mosquitoes want to breed in those places. So one mosquito bite can cause the disease. Okay, only one mosquito bite, and he can bite plenty after he bites one. So virus is not contagious. I already explained to you. There must be a person to mosquito to burst to a person. Okay? Is that clear? Okay? So one sickness, the mosquito has to bite somebody and to bite another one. Then you get the sickness. But not other than that. Okay, the signs and symptoms of dengue fever after being bitten by the mosquito carrying the virus, it has an incubation period of 8 to 15 days. That means when you're bitten today with something with dengue, you don't get sick tomorrow. It will take about 8 to 15 days. That's what incubation period means. Okay? Usually at least 1 week. Then if you get sick today, that means you were bitten last week. Okay? That's what it means by incubation period. Dengue fever starts with chills. Okay? Chills. That means you feel cold. Very cold. Hot weather like this, still you are chilling. Okay? Then you got headache, you got pain upon moving your eyes, and then you got lower back ache. Okay? You got painful legs and joints, and it occurs during the first hours of illness. Okay? So listen to this. Huh? It has a very high temperature, 40 degrees. And then all of a sudden, you become well. That means you're not well, only 1 day. Then after that, you will have the fever again. It's like that. It has 2 stages. Okay? So the first one goes down and then goes up again. And then you will have a very, very slow heartbeat. Okay? A slow heartbeat. And then your eyes become reddened. And then flushing or pale pink rash comes in your face. And then it disappears. Okay? But the lymph nodes in the neck, in the groin will come. Fever and other signs of dengue last for 2 to 4 days. Right? Then after that, I told you, it will be followed by no fever, rapid drop. But you're not well, just like you're well. Okay? And then they call it effervescence. And then you will be sweating, too much sweating. And then this precedes a period of normal temperature and sense of well-being that lasts about a day. You think I'm well. But no, the next day it will go very high again. Huh? And then characteristic rash appears. This time the rash will come all over your body except the face. Don't forget, in dengue there's no rash in the face, all over the body except the face, but it can also come redness in the hand and in the palm of the hand. Okay? So that's me, but not in the face. I don't know why. So what is the treatment of dengue? There is no treatment for dengue because it's a virus. No antibiotics. No rexithromycin. Everybody gets sick. They call me, hey, what is that thing? Okay, buy the antibiotic. No, not with dengue because dengue is a virus, so there's no antibiotics. But you just do symptomatic treatment. Symptomatic means symptoms, signs. You get headache, fever, maybe you can take Panadol or Panadine. Be careful with aspirin because aspirin makes the blood, diluted. So you might start bleeding some more. So be careful, don't use aspirin in dengue. You can only use Panadol, Tylenol. Because aspirin can, that's why in heart problem they try to give aspirin to make your blood diluted, but not in this one. In dengue, it will make it worse. If you're already bleeding and you make it loose, it becomes more bleeding. So Tylenol, Panadol, Panadine, it's okay, just to relieve the pain. But I told you, it's just to relieve the pain. It is symptomatic. So what is the prognosis for typical dengue fever? What is prognosis? Prognosis means what is the future? What will happen? What is the scenario? That's what it means by prognosis. So typical dengue is fatal in less than 1%. So it's not very serious. Only 1% can die. Huh? But you might be the unlucky 1%. So, huh? So only 1% will die. Huh? Plenty are affected. So 1% is the mortality. Acute phase of the illness with fever and myalgia lasts for 1 to 2 weeks. Then after that, you will get well. 2 weeks time, you will be fully well. So now, what is the prevention of dengue fever? I already told you. The transmission of this virus is through mosquito. So the only way we can prevent this is interruption. We have to interrupt the mosquito. We try to kill them as much as possible. You clean the places so they cannot survive. So if there's no mosquitoes to bite us, as I told you, not the ordinary mosquitoes, this is a special mosquito with the stripes. Okay? So that is the only thing we can do, prevent it. So to the end, this is what they do. Infected patients, like if a patient got already dengue, diagnosed to have dengue in the hospital, they have to keep him in a mosquito net. You know why? So that if no mosquito can bite this fellow. Because if the mosquito can bite this dengue, already fellow infected with dengue, then he can bite how many people? They will all get dengue. So when the doctors find out that this fellow is positive for dengue, they'll put him in a mosquito or seclude him. Put him in an aircon room. Nobody can go inside. Until 1 week, 2 weeks, until the virus will die. Okay? After that, then he can go out, no problem. Okay? Because it only lasts for 2 weeks. And now, this mosquito will be contagious until his lifetime. Then this mosquito can live for 2 to 4 weeks if you don't kill him. So 2 to 4 weeks is flying like this with the dengue inside him. Oh, dangerous. You should not be beaten in that time. So prevention of dengue requires control or eradication of mosquitoes carrying the virus that cause dengue. People urged to empty the stagnant water from old tires, trash cans, flower pots. That's why there's a decree. So government is doing everything, but they cannot do effective thing. The government said they already finished all the money. The budget of 2014 is already gone because of this. But it's still going. But government, of course, will put some more money there. Okay? So to prevent mosquito bites, we have to, like we wear long pants, long, we wrap ourselves like people in Saudi Arabia. They put everything like that. Long pants, long sleeves. Or you put repellent, okay? Or maybe you put the mosquito coil everywhere. But only thing, the smell is very bad. You can use that to deter them. So limit exposure to mosquito. Okay, listen to this. This mosquito is very dangerous 2 hours after sunrise and 2 hours before sunset. 2 hours after sunrise and 2 hours before sunset. This mosquito is different. It does not bite in the night. It bites in the daytime. Okay? Very rare that he will bite you in the nighttime, but it's usually 2 hours after sunset, 2 hours after sunrise. So that is the problem with this. So be careful on those time. Aedes aegypti mosquito is a daytime biter. Okay? It bites in the daytime. Other mosquitoes bite at night. This one will bite in the daytime. So it's a different kind with peak periods during sunrise and sunset. Okay? So with peak periods of biting and sunrise and sunset. So it might bite at any time, the day, and is often hidden. Like, some mosquitoes trapped inside your house. So it's flying inside, under your cupboard and everything. Then you open the cupboard, they come and bite you. That's very dangerous. You never know, they can go inside your house. So be careful with any mosquito. Since I said they're very small, they get a stripe, but you don't look at the stripe, he might bite you first. Any mosquito, just smack the fellow. So don't allow that mosquito to be close to you. So it's very common in rural areas where there's plenty grass or something. So there's no vaccination. This is the dangerous part. There's no vaccine to prevent it. They're still trying their best, but they say maybe in 2015 there will be a vaccine. Okay? So epidemiology of dengue. Epidemiology means how does it happen? How dengue is transmitted. It's caused by 4 closely related viruses. I told you 4 kinds of serotypes. Infection with one does not protect against the other. You can have 4 kinds, but you get immunity of all of them. And sequential infections put people at greater risk for dengue hemorrhagic fever. Okay, the one with bleeding, that's dangerous. it can cause dengue shock syndrome. Now, transmission of the dengue virus is between people by the mosquitoes. Okay? So there should be a mosquito that goes between to bite the one and then transfer to the other one. So 2 mosquitoes found all over the world. This Aedes aegypti and Aedes albopictus. Those are the 2 kinds of mosquito. I don't know what's the other one, but I know the Aedes aegypti is white stripe. Okay? So infected mosquitoes remain infected for the rest of their lives. So when this mosquito bites somebody with dengue, he will be infected until he dies. Until it dies. Maybe 2 to 4 weeks. So rare cases, they said also there are some cases that were recorded that it can be transmitted from a mother to an unborn child. That's like AIDS 2. But this is very rare. But there are some cases that they say the mother was bitten. Of course, there's a blood transfusion inside there. Then the baby will get it. Although it's very rare, but it can happen. So pregnant ladies are very dangerous when they get bitten. They can transfer it to that unborn child. Okay? And the baby can die inside. So evidence of transmission is already there. So majority of infected mosquitoes, but majority of infections is caused by mosquito bites, not transmission to the mother and the baby. So endemic in tropics and subtropics, it happens every year. It's high during rainy season. So we are not yet over. Periodic risk of epidemic when large numbers of people become infected during a short period. See, November to here, short period, there's a lot of people infected, so that's dangerous. So dengue epidemic requires a coincidence of large people who are infected and also a large population of mosquitoes on the same place. See? So when you have people who are infected already and you got plenty of mosquitoes, it's very dangerous. You can move around and bite everybody and transmit the disease to everybody. So we're lucky, especially in Ba. No case in Ba so far. Okay? But Lautoka, there's some cases and Dengue too. So Lautoka is not spared, so be careful. Don't go and Talanoa in the grass in the daytime because they bite in the daytime. But of course, they can also bite in the nighttime. Okay? Even the USA in America has no immunity. You see, it's a very modern country. There's also dengue there. History of dengue viruses originated in monkeys. See, the virus originated in monkeys and independently jumped to humans in Africa and Southeast Asia between 100 to 800 years ago. So it's a very long time sickness. So it was minor until the middle of the 20th century. The disruption of World War II is blamed for this. You know, during World War II, when the cargoes were coming, there were some mosquitoes inside the cargo. That's why it came all over the world. See? So today, there's about 2.5 billion people, or 40% of the population, live in areas where there is risk of dengue transmission. See? Almost over the world, half of the world, we have dengue possibility. 2.5 billion is already infected, and 40% of it at risk. Endemic is at least it's in 100 countries, and Fiji is included in Asia, Pacific, America, Africa, and Caribbean. The WHO, the World Health Organization, they estimate about 50 to 100 million infections a year. That's plenty. 50 to 100 million of cases a year in the whole world. So including 500,000 of dengue, hemorrhagic fever, and 22,000 deaths. 22,000 deaths every year. In Fiji, I think 3 so far. So in Fiji, since November 2013, they reported 6,800 cases. And 1,200 in the last 3 months, only 3 deaths so far. That's all I know. I don't know if there's more. Mostly in the Central Division. And 75% of the budget of 2014 already spent. That's what they said. Maybe by this time it's already gone. So no treatment, no vaccine, just only precaution. Okay? So any symptoms, go to the hospital. Deaths happen because of late consultation. Okay? If you have fever, joint pains, and headache, go to the hospital. Don't wait until it's too late, because prevention is always better than cure. Praise the Lord. I hope you learned something from this. Amen.